Eric, really good to have you here. Thank you so much for joining me. How are things going up in Seattle?
Hey, Jason, thanks for having me. It's always a pleasure. And thanks for inviting me onto your podcast. Things are great in Seattle. Always busy. Life of an entrepreneur is never a dull moment. So yeah, thanks for having me.
Fantastic. I should be visiting soon and I will definitely hit you up. So today we're going to be talking about the unique healthcare challenges experienced by the Latino community here in the US. So this is an incredibly diverse community in itself, of course, lots of different nationalities, lots of different cultures. It's 1/5 of the population of the US and it's the youngest demographic. What is the current state of healthcare for the Latino community in the US?
Oh man, it's a great question. So yeah, you're right. We are one of the biggest, if not, we are the largest ethnic minority in the country. We are 20% of the total US population. 1 in 4 US children are Latino. And again, Latinos are not a monolith, right? We're made up of a variety of different cultures and nationalities, with really 60% of the population being Mexican, which is what I represent. Healthcare for the Latino community, it's hard to say how it is for everyone. What I can tell you is that growing up for me, healthcare was not the easiest thing to navigate, which is why I work in healthcare. And what I've come to learn out of just decades of being in healthcare is that healthcare for the Latino community is filled with challenges. The one size fits all healthcare system is one that isn't the easiest to navigate, even for people like us who understand healthcare, because healthcare is not just about visiting a doctor when you're sick. It's about the importance of addressing the plurality of people's needs, right? The social care, the clinical care, the mental health. And so I have to say that right now we are facing some pretty interesting times, some pretty challenging times, and the community at large is dealing with a significant number of increasing barriers that make prioritizing our health a priority.
And of course, health and healthcare are deeply cultural because they touch all aspects of a person's life, right? And they are continuous in the end, whether we treat them that way or not. Over time, what have been some of the things that you've seen personally, both in your work and outside of your work, that are persistent challenges for the Latino community?
I think I have to say that access is one of the areas where we probably can really spend a good amount of time talking about just the barriers. Access, if you think about it, kind of boils down to a few different areas. For one, you have to understand that a large portion of the Latino community depends on Medicaid. Medicaid is primarily for poor or disabled populations, right, that are going to depend on Medicaid as insurance, right, to provide access to healthcare services, among other things. And what we know to be true in the US is that when you serve a predominantly Medicaid population, you're going to find a supply-demand mismatch. There are just not enough providers to meet the demand of the number of folks that are on Medicaid. And what this leads to is long wait times, and it just makes it really hard. Even if you wanted to prioritize, for example, preventative care, it makes it significantly more difficult for folks to really get in for those very important encounters that people need. So that's one thing. The other thing that we have to talk about that is important is that the business model right now in the US around fee for service, right? That is a model that really incentivizes people to take this kind of turn and burn mentality, right? Like the more people you see, the more you get paid. And that alone really poses significant impacts on broadly underserved communities, including Black and Brown communities, because when you only have 5 minutes with a doctor, you are less likely to really address, again, the plurality of people's needs. And what that means is that growing up in inner city Houston with parents who were working really hard to make ends meet, you realize that it's hard to really cover things like unmet social needs when physicians are only going to be able to spend 5 minutes with you. And so I think that is one thing that really compounds the issue around access for Latino communities, that we are, the model itself, the business of healthcare for Medicaid and for underserved communities is not really set up for long-term success. It isn't sustainable.
Yeah, this is a problem writ large with US healthcare, right? I mean, I spent a long part of my career in value-based care, which is really all around trying to shift that incentive to paying for outcomes instead of paying for a volume of services. And it's taking a long time to get there. And you also alluded to something really important, that most of a person's health is determined outside of healthcare, the social determinants of health, more than 3/4, more than 4/5, I guess. Can you tell us a little bit more about some of the non-healthcare things that impact the health of the Latino community, specific things that people from outside the community may not understand very well?
Yeah, well, obviously, people in my community are going to deal with a variety of factors. We could sit here and talk about just how different things are in rural communities versus urban communities. I grew up in inner city Houston, right? So I had 2 parents who worked multiple jobs, had older siblings, and we oftentimes didn't understand how to just manage benefits that we were either enrolled in or entitled to. So just health literacy and the literacy around the system is one of the first barriers that as a child growing up, we encountered.
And just very quickly on that, Erik, as two people who work in healthcare, I still struggle to understand it.
Of course, 100%. It's a big one, because I think what it comes down to is like also not seeing yourself in the providers who are there to serve you. And as well know, there are plenty of amazing doctors who are out there doing really important work. But when you have less than 6% of physicians in this country that identify as Latino, for example, it is very hard to connect with patients on a personal level, to build the trust. And it wasn't uncommon for me or my siblings to translate for our parents. I'll give you one, Jason. I remember being probably close to 12 years old when I had to deliver news to my mom and dad that my dad might potentially have prostate cancer. And that was one of those moments where no one prepped me as a child, but I was just the messenger.
And they didn't have a translator for you or anyone like that?
That was a delay, right? That meant that like that was one more thing. We had to hold onto that bed, hold onto that room. And I remember being in a hospital where there was 4 people in the same room. So it wasn't what we saw on TV was rarely depicted in real life for me growing up. And that's the thing, is that the system expected a child to communicate such important news without really understanding the impact it was going to have on the family, the dynamics. And it was just one of those things where you just realize that the healthcare system wasn't built for you. And a few years later, I ended up getting insurance through my mom's job. And we realized like this is what the other half of society lives through, which was to actually go to a pediatrician, not have to wait hours. Because for me growing up, the situation was if I was sick and my parents had to skip work, that meant that the paycheck at the end of the week was going to be short.
It's a really common problem with healthcare access, right?
Exactly. And so trade-offs, right, being made, especially within these underserved communities, is that people are having to make a decision between paying for the light bill or paying for a prescription. Those are the things that are impacting these communities. And when that happens, it has a ripple effect. It has a compounding effect in that it might be a light bill this week, but it might be the house note. It might be the grocery bill. And so all of a sudden, we're starting to see what we couldn't label before as a child. We didn't know what housing insecurity was. We didn't know what food insecurity was. And those are all things that play a significant role in how our communities get to prioritize their health. And so that's why it's important for us to not consider this a nice to have in the broader healthcare landscape. It is healthcare, right? Knowing what's happening in the homes of our patients is really a relevant and critical part of seeing the whole.
And I came across a very surprising statistic. The data is from last year, so this is from 2024. Around 1 in 4 Latino adults lack healthcare coverage at that time, which is about 3 times higher than white or Caucasian Americans. Is that true?
Yeah. So yeah, you're right, Jason. 1 in 4 Latinos in the US lack access to healthcare. And yes, many of them are going to be uninsured or simply just do not have regular source of care. And I think this goes back to just understanding whether it's through work, right, through your employment, that you have benefits offered to you. At the same time, some people will just simply deny coverage because they can't afford to contribute to the premiums that they're responsible for through their employment. And navigating Medicaid, Medicare, the social benefits that are available to many people, whether they're children, adults, or seniors, those processes, again, vary state by state. As you know, we're talking about things today around policy, and in the news, you're hearing about work requirements and work authorization. There is a lot of red tape, and there's going to be more red tape coming online soon. But the process to enroll in Medicaid and to stay on Medicaid is a difficult thing to navigate, and without the appropriate help. And this is why community-based organizations in many underserved communities are really important. They play a key role in helping to promote access to not just these important benefits, but also navigating people through the application process, through the work requirements. And so it is no surprise that we are seeing such a staggering number of Latinos, Hispanics in the US that lack access to healthcare. It is a series of systemic barriers, some which I believe are intentional, that lead to such a staggering number.
And just to help people understand a bit better, what are some of the policy changes over the years that have influenced this? We've obviously got the Affordable Care Act, which should have improved things. More recently, there are some other things that may be worsening them. Can you just help us understand what are some of the policy changes there of note?
Yeah, I mean, right now, a big topic of discussion is immigration status. We know that every state had a choice to decide whether they wanted to expand Medicaid, right? So go above and beyond what is covered under the federal mandate for Medicaid. And in states like California and Washington State, we saw over the last couple of years, the state decide to extend access to state-funded healthcare insurance through their own state-offered health insurance or through their own state exchanges. And that's where we did see some really good mechanisms put in place. But now we are seeing policies that are starting to unwind that. And so while we've made steps forward for the Latino community at large, especially folks who are in mixed status housing situations, we are seeing policies today that are winding that back. And we've seen now concrete evidence that there is an end to those programs. For example, in California, starting next year, people will no longer be eligible for Medi-Cal, which is the program that was extended to everyone regardless of immigration status. And so that's definitely something that we're seeing as a big policy shift. And even before that, the process for a lot of the people in my community, main barriers, again, beyond immigration status, is the fact that language, affordability, clinical availability outside of work hours, we have transportation issues. Again, goes back to all of those, things that we bucket as social determinants that really pose themselves as big barriers. And we see policies of all shapes and sizes on a state by state level and also at the federal level that have always made it a little bit more difficult for people to get access to not just health insurance, but healthcare services across the board.
So if we talk about inequity more broadly, and I've often said that you can't really separate health and social care because the two are so closely intertwined, just the economic gap. So I found another interesting statistic. Less than 3% of US wealth is held by Latino households, despite the fact that, again, this is a fifth of the US population. And so you can't really decouple these things. When we start to talk about these social determinants, housing, food, work, education, they drive the majority of health outcomes. And it's very hard to say that these things don't matter. What are some of the other contextual factors outside of the policy barriers, the economic barriers that are leading to these poorer health outcomes in Latino communities? And just to reference a couple of them, we have a higher rate of obesity in the Latino community compared to, let's say, the white Caucasian community, about 10% more. A similar stat for diabetes. So for chronic diseases in particular, we have far worse outcomes. What are some of the other things that are going on there?
Yeah, I mean, you bring up a great point, Jason, in that Latinos and also just the wealth distribution. I want to just bring one thing to your attention is that if we were to look at Latinos, right, the US Latino economy, as Latinos, we produced $3.2 trillion in GDP in 2021. That would make Latinos the fifth largest economy in the world, behind the US, behind China, Japan, and Germany, and ahead of India, the UK, and France. The Latino GDP grew 2.6 times faster than non-Latino US GDP from 2011 to 2021. So what that means is that we are a force. And so sometimes people talk to me about serving the Latino community, is it a niche? I think that those numbers tell you otherwise, right? And despite, again, a lot of immigration policies that are, really kind of owning the headlines today, we're a key part of the US economy and something that really is worth the investment. With that said, yes, there is a lot of room for us to really improve access for these communities. And there are a number of things that we're seeing in terms of broader inequities that Latinos face in this country. So we did talk about health access and coverage, right? 1 in 4 Latinos lack access. We talked about that. We talked about how Latinos are likely to be uninsured. We talk about the language barriers and the fears tied to immigration status. But when it comes to chronic diseases and outcomes, the one thing that I think really gives me a lot of hope is that there are a lot of comorbidities that people are dealing with, a lot of chronic conditions that Latinos are performing at a worse rate. And the reason why, maybe as an entrepreneur, Jason, I'm an eternal optimist, is that a lot of the things that you just mentioned are things that are reversible, right? Diabetes, right? Latinos are 70% more likely to develop type 2 diabetes than their white counterparts. Obesity, 43% of Latino adults are obese compared to 36% of white counterparts. We talk about liver disease, kidney disease, all leading causes of premature death in Latinos. And the thing is that you tie this back to why, right? What's the hypothesis behind this? And it's because Latinos are less likely to receive preventative screenings for cancer, for heart disease, depression. And there are a number of reasons why. And I think that's why I'm so focused on trying to figure out some of the solutions, which I know we can talk about here in a little bit. But it's this type of data that gives me hope that if we were to figure out sort of how to address these upstream barriers and inequities, that we can actually create value for these communities. Mental health is another one, right? Latinos are half as likely to receive mental health treatment. Why? Stigma, cost, limited bilingual providers. Again, areas where we could really invest and improve the situation for these entire communities. There are also economic and social determinants, right? So higher poverty rates. We have over 60% of Latino children who live in low-income households. We, especially during the pandemic, right? Latino workers are overrepresented in frontline and high-risk jobs. We are also dealing with environmental factors, right? We tend to be living in communities where We're exposed to higher rates of air pollution, fewer parks, food insecurity. We talk about food deserts. And then to wrap it up, it's also the housing instability. We're more likely to rent, face overcrowding, and live in areas with environmental hazards. And it's very common, especially within Latino communities, to live in multi-generational households, which brings also a variety of issues. And so we could talk about that and really dive into those specific angles. But I think it's important to see that there are multiple things at play. And we're not going to solve for Latino health by just creating access to doctors, which is a very important piece. It's about seeing the situation as a whole, right? From the environment to the access to the social barriers to all of those things play a critical role. And again, I tend to want to not oversimplify things because this is not a problem that's easily fixed. But I think that if we start to think about healthcare and healthcare delivery a little different, it allows us to really start to address some of these barriers and really start to move the needle towards addressing some of these broader inequities that the Latino community faces in the US.
And just to add one more piece of context, this paradox that we were talking about offline before doing this recording, that new immigrants from Latin American countries have a longer life expectancy than their counterparts who were born in the US. So there is a US aspect to this, and we can talk about family structures, we can talk about social bonds, healthier eating, maybe sort of more physical activity. But what else is going on there that means that the United States of America lifestyle, or the way we live here, is leading to poorer health outcomes than where a lot of Latino immigrants have come from in Latin America?
Yeah. I think it's a great call out to bring up the Hispanic paradox, right? It's an interesting one. And I think a lot of people are a little stumped by what the data tells us, right? Which is that Latinos in the US tend to live a little longer and have lower overall mortality rates than non-Hispanic whites, despite, having higher poverty, lower insurance coverage, and limited access to care, as we just discussed. I think what matters here is probably less about some of the anecdotes around what the data shows and maybe really understanding where there might be gaps in the broader narrative. I think for one, there's probably gaps in just some of the research. I know I've heard various different explanations for why the paradox might exist. One that I've heard that I don't know if I fully believe it is that there's this like healthy immigrant effect, right? That people who migrate tend to be healthier, more resilient, and motivated. Oftentimes people will even go a step further in saying that a lot of times when people get sick and are near sort of death, they'll go back home and therefore aren't counted for in the research. Others are going to tie back to just the social and the family networks, which again is a really important part of the Latino community, which says that strong communities and those ties within families, right? And the cultural values. There's some important isms that we talk about within the Latino community, which is the familism and Marianismo. There are a lot of like key things at play here that I think really help buffer stress and promote healthier behaviors, despite, again, all the stats around diabetes and all of that. So those are things that I think are worth thinking about. I think, however, if we were to take a step back and look at where things are going, I think that the advantage, which highlights that Latinos are living a little longer, I think that advantage over time, if we follow the data, if we start to really use technology to understand a lot of the nuance and details, will show that the advantage is probably shrinking. I think we're seeing Latinos experience like steeper drops in life expectancy, especially during and after the pandemic, than any other group. I think we're also seeing acculturation, where we're seeing people tend to erode some of those early health advantages because we're starting to eat like the rest of society and adopt those lifestyles. And again, the economic stresses, the housing insecurity, the exposure to those environmental hazards will probably show that advantage that's attributed to this Hispanic paradox is changing and shrinking.
We'll get back to this conversation in just a moment. But if you're finding this episode helpful, here's a quick ask. Take a second to follow or subscribe to the Health Curve podcast, wherever you're listening. And if someone else in your life would benefit from this episode, or any of the others you've heard, please send it their way. It's very clear that there are structural barriers here, both within and outside healthcare, that are leading to poorer health outcomes for the Latino community. And this is happening for other communities as well. This is not an ethnic minority community. This is an ethnic majority community, 1/5 of the US population. As a fellow optimist, I want to talk about solutions and what is going well and what's working. What are some of the things that we've seen change that are contributing to better health outcomes in this community?
That's a great question. I think that when it comes to some of the changes that we've seen in these communities that have led to better outcomes, first of all, there are key programs across the US that are starting to really incentivize healthcare providers to think about healthcare more holistically. And when we see programs that do prioritize and fund and cover as benefits some of these social determinants, I think it really does allow us to meet people where they are. And so, for example, when we talk about families who are dealing with comorbidities, right, or dealing with chronic conditions across an entire household, right? Again, multi-generational households. Imagine children, parents, grandparents living under one roof. If we're waiting for people to go into the clinic or to the hospital when they're sick, you're only going to get a very small snapshot of what's going on. But when programs are implemented where you leverage solutions like community health workers to be part of the care team, to go out into the community and connect with not just the patient, but the entire household, you get to uncover the social determinants at play. And when you start to address those and tie those to the benefits that are covered in some states, you realize that not only are you addressing a pain point for a household, but you're also building trust. And trust is everything when it comes to healthcare. And I think when you see these programs implemented and you see that you're able to address those social determinants, you see that trust is being established, you recognize that through that, you then start to get people connected to the right care at the right time. And we're seeing results. We're seeing that when you focus on 5% of the population, which makes up 50% of the cost, especially within Medicaid, that the way you move the needle to reduce cost is by addressing, again, that plurality of people's needs, the holistic view. And I think that programs like CalAIM in California, which really do focus on addressing the unmet social needs for specific populations of focus, you're going to see results which lead to not only improved outcomes for the member, but we're talking about reduced costs. And at this day and age where Medicaid funding is being threatened, the idea that Medicaid needs to really do more with less, those are the types of programs that are going to yield the types of results that we need to see across these communities to ensure that we're getting ahead and really putting these underserved communities on a path to better and improved health.
Right. I mean, there's a lot of evidence from all over the world that this community-based care model, community health workers, where you have health and social care services delivered in or close to people's homes and communities, you have trusted members of these communities involved in the design and delivery of these services. That approach to healthcare is cheaper and more effective and improves the outcomes of that community consistently. And so that is a model that needs to be championed a lot more. Are there some examples? I know that you have your own organization that's doing something in this space. Can you tell us a bit more about what that looks like and how it works?
Yeah, I think what's important to note here is that, yes, back in 2020-21, I started a company called Zócalo Health. This company was inspired, again, by my lived experience, right? I talked about what it was like growing up in inner city Houston, navigating my parents, my family through our one-size-fits-all healthcare system. And I knew that there were a lot of really great lessons learned in other countries and how people were able to really manage care delivery in a much more efficient and cost-effective way. And so we decided to build a model that, again, focused on underserved communities, primarily the Latino community, because, again, it is far more likely, especially in California where we started, that a majority of our patients were going to be Latino just because of the dependency on Medicaid or Medi-Cal in California. And we knew that we wanted to build something that would help us prevent, again, that trade-off, that we could help families avoid that trade-off between paying for a prescription or a light bill. And the use of community health workers was one tactic that we knew could be really helpful. I don't know, Jason, if you're familiar with the movie Moneyball, right? Where you have a baseball team with resources, right? We thought, how can we Moneyball healthcare, right? I can't create more doctors. I can't afford to hire every doctor. We have a generational problem here that I can't solve as an entrepreneur to bring more Latino physicians to Latino communities. So what we had to do is we had to find resources that were readily available, and that was community health workers. And then the next challenge was like, how do we embed them into the care team? Not to make them secretaries or admin assistants. We wanted to make them a core part of the care team. And so we borrowed lessons from the healthcare system in Costa Rica, where we could see people go into remote parts of the country. And we decided that we would test that out in California, going into rural parts of the state where, there were limited options for care, where there were 3 to 6 month waits to see a PCP, even if you had insurance. And it's where we started to see early data that we could replicate these models successfully, effectively, and truly moneyball the situation where we would leverage the resources that were available to us and really get a strong ROI, demonstrating that we could engage people, that we could retain them month over month, and more importantly, build trust so that we could steer them to higher value patterns of care. And that right there, I think, is a testament to the type of work that we need to see more often, because I think for too long, we've also seen people who depend on Medicaid, really depend on a safety net. Almost like it's like, oh, you shouldn't really expect much else. Like, get what you can and just be proud of that, or just be grateful
Right.
for some care. I think our model really challenged, you know what, our communities deserve more than a safety net. They deserve more than philanthropy. It plays an important role, don't get me wrong, but that we really needed to be intentional about creating experiences that really speak to people, really speak to their individual challenges, that really speak to the community and the family, and that, again, are anchored in trust. And when you do that, I think you're really able to deliver this culturally attuned whole person care that yields the types of results that we need to see in this very unsustainable healthcare system that we've built.
And so as we start to move towards advice to listeners, so both the Latino community and allies, which should be everyone else, how can people navigate their health and their healthcare better with some of the things that we've talked about today in mind?
Yeah, that's a great question. First and foremost, we have to think about healthcare not just in the exam room. We have to think about healthcare in the community. And so it's important for us to not only think about what we know, right, or what we've been sort of what's been embedded in us as healthcare builders, but we do have to think outside the box. And so I have to, again, stress that it starts with trust. We have to ensure that everything that we do when we build for underserved communities is anchored around trust, because it's ultimately the currency that really carries a lot of weight, especially in the Latino community. The other thing is that we really need to start thinking about how we design for access, not awareness. I think it's important for us to realize that the idea of like build it and they will come is not going to be applicable here. Even though there is a shortage, we have to get over the trust. We have to establish ourselves around meeting people where they are. Technology, AI is not going to solve for these pain points overnight. Those are really important tools that we should embrace, but they should be used to augment the people that are out there, the boots on the ground doing the work, the physicians, the community health workers, the nurses, the mental health experts that are out there doing the work. Being culturally fluent is not a feature, it is a requirement. Translating content into Spanish is not cultural fluency. We have to understand values like familismo, respeto, personalismo. These are how people make decisions around family, trust, and respect. Again, avoid the one-size-fits-all Hispanic campaigns. Latinos are not a monolith. We have to really think about even the nuance within each of these rich and vibrant cultures that we call our Latino community. And then I also highlighted building economic value, not charity. We want to build sustainable business models, not just in Medicaid, but there's a lot of work to be done around Medicare and dual eligibles, people that are eligible for both programs. And those programs really need to be focused on improving outcomes, reducing total cost of care, and more importantly, creating an amazing experience, not just for our patients, but for our limited providers as well. And then measure outcomes that matter, right? Make sure that you're not just tracking the clicks or the visits, right? We want to make sure that the retention, the social needs that we're targeting are being resolved, that care gaps are being closed, and overall that member satisfaction is above and beyond, because this community deserves so much more. I think there's a massive market opportunity for entrepreneurs, for builders. And not only is it such a big opportunity from a market perspective, I think it's another thing that highlights that if we're going to build in this space, I think it's also important to recognize that you can do good for communities while doing well. And if you take all of those things into account, I think it is possible for us to build large, scalable businesses that not only do well as a business, but do well for the communities who have long been underserved.
And then how about for the patients and the families themselves? What advice would you give them?
Yeah, I think it's important. Right now, families and patients, especially in the Latino community, are dealing with a lot from a policy perspective. Right now, there is a lot of fear. We're seeing a lot of anxiety, a lot of depression, a lot of trauma increasing. We're seeing people retreat much the way we did back during the pandemic. I think that right now, patients and their families are probably finding it very difficult to find safety and refuge in healthcare. And that breaks my heart so much. But right now, my advice is that it's more important for us today than ever to make sure that we're prioritizing our health, to do not retreat, to find those systems in your communities that are doing the work, that are building the trust, because without health, we don't have much. And so I think that it's really important for our patients, for their families, to find those allies like Zócalo Health and the many partners out there across the US that are there to advocate for them, to bring care to where they are, to again build that trust and that safety and that refuge that I know right now is missing. And there's a lot of work for us to do ahead. But I think that my advice to them is to continue to prioritize your health where you can, find those allies, find those champions in your community, and stay together in unity, because I think it's going to be through community that we get through some of these challenging times.
And we'll be sure to add some links in the show notes so that folks can have access to those resources. Erik, thank you so much for joining me today. I'm sure our listeners will get a lot of value out of this, and we'll do our best to continue to amplify the message as much as possible.
Thanks so much, Jason. It's always a pleasure catching up with you.